Hello and good morning, everyone. Thank you for joining us today for our CEDA Helps Understanding the Affordable Care Act ACA Insurance Open House. We will begin the webinar in about 2 minutes. We are going to start promptly at 11 a.m. So thank you for joining us. We will begin at 11 a.m. Thank you.
James?
Yes, ma'am.
I just want to make sure that you ended the practice session and launched the webinar.
Yes. Okay, great point. Great point. Yeah, should have launched when I was able to admit you guys. Okay, let's see, broadcast, annotate.
It looks like it's recording, so I think it might be up, right?
Yeah, we should be good. We're good to go. Got my phone ready just in case Tasia needs to message me on the side. Chat. Yep, we are live and we are good to go. A few seconds. All right. Thank you all for your patience and joining us this morning for our CEDA Helps Understanding the Affordable Care Act Open House. We are beginning. It is 11 o'clock, so we're going to start promptly at 11. Hello again. My name is James Flagg. I am one of the outreach coordinators for CEDA of Cook County, and I will be your host for today. We're extremely happy that you're able to join us for this webinar. Before we begin, I do want to formally welcome you all to our open house and send a very sincere thank you to all for joining us this morning. Now, as many of you know, CEDA is fueling our local economy and placing the buying power back into many of our Chicagoland communities. We offer individuals a wide range of services and support to stabilize clients with immediate financial assistance, as well as provide sustainable solutions needed to change their lives through the following programs. Utility bill assistance, or LIHEAP, which offers monthly gas, electric, and water bill assistance. We also provide home weatherization, which makes your home more energy efficient, cost-effective, and safe to live in. We have WIC services, or Women, Infant, and Children, which delivers food and nutritional education for new moms and caregivers at large. And lastly, we offer programs through our Family Support and Community Engagement, or FACE program, which provides case management and a wide range of services like dental, vision, transportation assistance, scholarships for college, as well as job readiness. Now, there's a wealth of resources that CEDA provides, and yes, you still have an opportunity to get assistance with the services that were just mentioned. However, we occasionally like to bring in partners to this platform who offer additional services that our clients can use and benefit from. Now, with this in mind, we have decided to modify our open house to invite one of our very special partners, Bright Healthcare, to come in and discuss the Affordable Care Act insurance options, why health insurance is important for you, what you need to do to ensure your family and loved ones are covered in case of a medical event or a health event. So again, welcome to our CEDA Helps Understanding Affordable Care Act Insurance Open House. Now, if you do have questions about the ACA or Affordable Care Act or how coverage works for you, you are in the right place. Now, before we dive into our presentation, just a little bit of housekeeping. I'm going to launch a quick poll for all of our viewers. If you haven't already, please share a little bit about yourself in our poll that should be popping up on your screen now. Our team is in the comments ready to chat with you all along the way. So feel free to drop your questions or comments in the chat. We'd be happy to engage you. And also, we are recording this open house. So if you do miss some information, don't worry. You can rewatch this anytime on our website, www.cedaorg.net. All right, give it a few more seconds for our poll. So please get your responses in if you haven't finished. And thank you for those that have participated. Let me go ahead and close this poll out. Now, without further ado, here to walk us through the Affordable Care Act is the Individual and Family Plan Illinois Regional Sales Manager for Bright Healthcare, Mr. Jason Plaga. Welcome, Jason. Thank you for joining us today.
Thanks so much, James. What a wonderful introduction. And I'm going to throw up my screen right here. So just one moment.
Perfect. Take your time.
Thank you.
All right.
Can everyone see my screen now?
Yes, sir. Looking good.
Perfect. Well, I appreciate it. Thanks again, James. Hello and good morning, everyone. My name is Jason Plaga. I am the Regional Sales Manager for Bright Healthcare and live right here in the city of Chicago. First and foremost, thank you for taking time out of your busy schedules to join today's open house. And thank you to the CEDA team for your partnership and for having us talk about the super important topic of health insurance. Why health insurance is super important and relevant right now is because we're in what we call an open enrollment period, where you, the consumer, have the ability to purchase health insurance for you and your loved ones, as James mentioned. My goal today is for all of you to walk away from today's session learning something new or feeling refreshed about health insurance options so you can make informed decisions for you and your family. So thank you again for joining, and we'll jump right in. So here's what we're up to today. We'll first start by talking about an overview on individual and family plan market. We'll then talk about marketplace plans, market costs, how to shop for health insurance plans during this open enrollment. We'll talk about federal help, otherwise known as subsidies or tax credits. And then we'll round out today's open house session with all of the resources that you have available to you, including a question and answer session to help you again make these informed decisions during this open enrollment period. So let's just jump in. So you may have heard of IFP before. IFP stands for Individual and Family Plans. That is an interchangeable acronym, can also be known as ACA, the Affordable Care Act, or the under 65 market. So the individual and family plan marketplace is comprised of millions of consumers who buy their health insurance through federal or state-based exchanges. People that purchase through these state or federal exchanges include those who are not eligible for Medicare, so consumers who are generally younger than the age of 65. 2, not eligible for government services or programs like Medicaid or VA care. And 3, those who are not eligible or choose not to enroll in employer-sponsored products. So an example would be is if you're working full or part-time and your employer currently offers you any type of health insurance benefits that they will partially sponsor, unfortunately, those people are not eligible to purchase health insurance through the individual and family marketplace. Here are some examples of some common demographics of folks who do purchase health insurance through the marketplace. So the first scenario would be someone who might be 27 years old, no longer on their parents' insurance. So as you may or may not know, you have the ability, any dependent child up to the age of 26 can stay on their parents' plan, but as they age out to 27, they will have to purchase their own health insurance. This person might be a student, whether undergrad or graduate student, and a person who may qualify for federal help or what we like to call subsidies. The second scenario would be a family. Parents are self-employed entrepreneurs, possibly, who may also qualify for federal help or subsidies. The third scenario, consumer demographic, would be someone who is 55 years old, who might be retired but not yet eligible for the federal program Medicare. So as you know or may not know, the Affordable Care Act, or ACA, has a huge impact on health insurance for individuals and families. So you might remember back in 2010, the Affordable Care Act was enacted by President Obama and his administration, and that had a real impact, again, on how individuals can purchase health insurance. The first impact that it had was defining what we like to call the required 10 essential health benefits, What this means is that all health plans that are sold on the health insurance marketplace must have these 10 essential benefits. And we'll go into that in just a bit here. The second impact it had was the creation of time and place to purchase plans. As I mentioned before, we are experiencing and are in an open enrollment period. We'll talk about the time frame of that period and what that means. The second is where to buy health insurance. So the ACA created what they call marketplace exchanges, both at a federal level and on a state-based level. The third impact that the Affordable Care Act had was the creation of 2 subsidies, or what I like to call federal assistance in paying your health insurance premium. The first would be Advanced Premium Tax Credit, or what the acronym stands for is APTC. And the second would be cost share reductions, which means getting help in lowering your out-of-pocket costs on the insurance plans that you purchase, otherwise known as CSRs. So those are the 3 main impacts that the ACA had on individual and family plan marketplace. So let's talk about what a qualified health plan is and what this means to you. So qualified health plans are insurance plans that are certified by the health insurance marketplace, by the individual and family marketplace. They provide essential health benefits, as we talked about before, follows established limits on cost sharing. So I'm sure you've heard terms like deductibles, co-payments, and out-of-pocket maximum amounts. So they've defined specific limits on those amounts. And it also meets other requirements under the ACA. All qualified health plans meet the Affordable Care Act requirement for having health coverage known as what we like to call minimum essential coverage. If you'd like to read up on what all of this means and in more in depth, definitely utilize healthcare.gov as your primary resource for any type of information regarding what a qualified health plan means. So as I mentioned before, all health insurance plans that are offered through the health insurance marketplace must have these 10 essential health benefits to be considered a qualified health plan. The first would be coverage for ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, coverage for prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and lastly, pediatric services, including oral and vision care. So when you're out there as a consumer shopping for insurance products for you and your family, you want to make sure that it is a qualified health plan. It is truly a qualified health plan as outlined by the Affordable Care Act. So as long as they have these 10 essential health benefits that are covered for you and your family. So now let's talk about understanding enrollment and marketplace exchanges. So as I have mentioned before, we are currently in an enrollment period. We're in what we call open enrollment. This is the annual time period when you, the consumer, have the ability to purchase and enroll in health insurance plans on the individual and family marketplace. So this started on November 1st of this year and will go through January 15th. This is the time where you and your family can make health insurance decisions. There's also what we call special enrollment period, or SEP. This is when you, the consumer, have a qualifying life event, or what we like to call, a lot of acronyms here, QLE, that enable you to purchase or enroll in plans outside of the open enrollment period. And some examples of a qualified life event that would trigger a special enrollment period for consumers would be getting married, having a baby, moving from one state or another. These are some common QLEs, but there is a long list of eligibility. So definitely go to healthcare.gov to find out more about what those qualifying life events can be. Now, how to purchase health insurance. There are 3 ways to purchase health insurance. You can go directly to an insurance company. So you, the consumer, can purchase a plan directly from insurance companies. However, you won't be eligible for a tax credit or any federal assistance. The second, which is highly recommended, would be the marketplace enrollment. This is for you, the consumer, enrolling into a health insurance plan through the federal or state exchange. Now, here in Illinois, we utilize the federal exchange, which again is healthcare.gov. The third is what we like to call an enhanced direct enrollment, or EDE. So you might go on Google or Yahoo and do a search for individual and family plans, and a whole list of many different companies that sell health insurance products will allow you the ability to purchase insurance through those specific websites, and they have direct connectivity with healthcare.gov. So that experience would be not having to go through healthcare.gov, rather through a website that has direct connectivity. The safest bet to ensure that you're purchasing a qualified health plan to see if you are eligible for federal assistance with subsidies and cost share reductions, it is always your best bet to go directly through healthcare.gov, which is the second option here to purchase, which is the marketplace enrollment. So how does the marketplace work? How does the exchange work? So again, to access the FFM, or the federally facilitated marketplace, you're going to go visit www.healthcare.gov. Some states, as I mentioned, do run their own exchanges, but the state of Illinois utilizes the federally facilitated marketplace, which is the FFM. All exchanges offer assistance, so know that you do have resources and actual live people to help you make those decisions. So consumers can use an insurance broker, they can use what they like to call navigators and certified application counselors, which are all available at your disposal. And again, going to healthcare.gov is how you're going to be able to find any type of live assistance. Also, as a reminder, exchanges and the FFM are the only place that you, the consumer, can receive that federal assistance, that's those subsidies. So now let's talk about all of the different plans that are offered. You may have heard these terms before, or maybe familiar with them already, but there are a variety of different plans available to meet you and your family's needs based on how you want to utilize your plan and how much you can afford. So you might have heard of gold, silver, bronze, and catastrophic plans. The way I like to look at these plans are as such here. Gold plans, think about those as a little bit more expensive premium, where you, the consumer, are typically paying services at 20%, while the plan pays 80%. Silver, which is the most commonly purchased and enrolled in health insurance plans, are mid-range cost, where you, the consumer, are typically paying 30% out of your pocket, while the plan pays about 70%. Then there's bronze, which I like to think of as the most affordable plan designs, in which you, the consumer, are responsible for about 40% of the service it costs, while the plan pays about 60%. We also have plans available out there called catastrophic plans, which again are higher deductible plans. They're lower premium costs, and again, very similar to bronze. You, the consumer, paying about 40% of the services, while the cost of the plan pays about 60%. I know this is a lot of information, but we'll go deep diving into each plan. So again, gold, remember that this is more of a higher premium, lower out-of-pocket type of plan. So more expensive upfront with premium costs, and also paying less when it comes to any services that you have to utilize. So again, a 20-80 split. The second would be, again, silver plans. This is, again, the most commonly purchased plan on the marketplace. And why silver is so important is, if you remember in a few slides ago, I mentioned cost share reduction. So this is the only metal level or metal tier silver plan where you can receive some additional assistance in out-of-pocket costs. So an example would be, let's say a deductible on a traditional silver plan is $5,000. You may qualify as a consumer based on your household income for a cost reduction, where that deductible might turn into maybe $1,000 or $500 or $0 even. For bronze plans, this is really more of a high deductible plan where again, the premium is going to be a little bit less, but the cost that she'll be paying throughout the year for services is split at a 40% versus 60% in which the health insurance plan pays. And lastly, catastrophic. So catastrophic plans are typically for those consumers who are at least 30 years of age or under, and who meet the hardship financial exemption as outlined by the Center of Medicaid Services. So these are for folks who have to meet a specific income level in order to qualify for these plans. The goal of this plan is essentially to provide access to those who are under 30, who again would like to have health insurance coverage for, of course, major illnesses or any type of accidents. Think about this plan as a lower cost plan, but again, you are going to be paying a little bit more for services throughout the year, as it's split 40% you, 60% the insurance company. So as you're making informed decisions for yourself and your family, this is a nice little illustration on how to think about where you might want to start to look with regard to what plan is going to be the best for you and your family. So taking into consideration a gold plan, this would be a really good plan for a consumer like you who has maybe a lot of prescriptions or anticipates a lot of provider visits. A gold plan can generally have, again, a higher monthly premium, but pay more of your costs when you need care. As for silver, bronze, and catastrophic plans, this is going to be a great option these are going to be great options for you for consumers with lower incomes who can potentially receive subsidies on certain silver plans. And this is also going to be good for consumers who do not expect to use regular medical services or don't take regular prescriptions. Again, a silver, bronze, and catastrophic plan is going to cost less per month premium-wise, but pay less costs when the consumer is going to need care. So this is a really good illustration when you're making your decision. For example, I myself maybe would look at a bronze or silver plan. I don't take any type of maintenance medications through the year. I maybe go see my doctor once or twice a year just to get a general checkup. I want to pay as less as possible on my premium. So I'm going to probably look at purchasing a silver or a bronze plan for myself. Now, my grandmother or let's just say my mother, for example, she might have quite a bit of prescriptions. She might go see her doctor every 3 months. So a gold plan might be a better option for her. It might be a little bit more expensive, but the coverage is going to be a little bit greater for her. So I hope that all makes sense. So now let's take a look at subsidies, or what I like to call federal assistance, with helping to pay your premium and potentially reducing some costs on out-of-pocket costs on the plans that you purchase. So as I mentioned before, there are 2 types of consumer subsidies. First is Advanced Premium Tax Credit, or APTC. This tax credit is taken to lower monthly premium payments, only for qualified health plans purchased through an exchange, and this is going to be based on an individual consumer's annual household income. The second is cost share reductions. As I mentioned before, this lowers the amount one pays for deductibles, co-payments, and co-insurance. Cost share reductions are only available on the silver meta level tiered plans that we talked about previously. So how do advanced premium tax credits work, APTC? So you can either take these credits upfront to pay directly to the health insurance carrier, or you can take these credits at the end of the year when you file your taxes. The best bet for you is going to be taking those credits upfront, so you're not having to deal with this at the end of the year. Now, you might be wondering, how do I find out if I'm eligible for advanced premium tax credits? And that is all going to be done at the healthcare.gov website. You'll fill out information about yourself, your demographics, your household income, and then the marketplace is going to shoot you out an eligibility letter. This is how much you qualify for from an advanced premium tax credit standpoint, and this is the amount that's going to be applied when you are shopping for and enrolling in a health insurance marketplace plan. Now, cost share reductions, again, these are going to be for consumers who meet non-financial eligibility requirements and make up to 250% of the federal poverty level. This is where you're going to, again, only apply these cost share reductions to silver level plans directly through the exchange. And you might again be wondering, how will I know if I am eligible for additional cost share reductions? And it's going to be the same thing. When you're filling out eligibility on healthcare.gov, they are going to determine based on your demographics and your household income if you do in fact qualify for these additional cost share reductions on top of the advanced premium tax credits that we talked about on the previous screen. So again, how does cost sharing work? A silver plan may have a higher premium than a bronze. The total medical also includes co-payments, co-insurance, and deductibles. And the deductible could be thousands of dollars less than typical bronze plan and will have much more robust coverage. So again, cost share reductions only apply to silver plans. Now, they might be a little bit more expensive than bronze, but cost shares can really help you in a silver plan. So that's why a lot of consumers like yourself, they go in, they notice that they are eligible for advanced premium tax credits, and they're also eligible for cost share reductions. So they automatically enroll themselves into a silver plan because it makes most sense. So who are not eligible for subsidies? So there's a long list, but here's a short list of those that are not eligible for subsidies. One would be persons who are not lawfully present in the United States, persons who have affordable employer-sponsored coverage as an option, persons who are incarcerated, and persons with other government-sponsored healthcare. Again, a longer list is going to be available to you on healthcare.gov. In summary, again, two types of federal assistance: advanced premium tax credits, otherwise known as APTC. This helps you pay for your premiums. And then on the right-hand side here, cost sharing reductions, CSRs. This lowers the cost when members receive care. All right, so as we round out today's session, here are some resources that I definitely would recommend all of you to take a look at in your decision-making process. So as I mentioned, access to the federally facilitated marketplace, resources and tools can be found at www.healthcare.gov. You can also find information, consumer information, on cms.gov, which is the Center for Medicare and Medicaid Services. And then also, if you're interested in finding local help, and I definitely recommend this because again, even though we've had a pretty in-depth conversation today about health insurance and your options, you know, it's always super important to continue to ask questions. So you have available to you what we like to call certified assisters or navigators. And the way that you can look for local help is by, again, visiting healthcare.gov. And you'll see on the screen here, there is an option to input your city and or your state and zip code. And it'll give you all of the certified assisters that are trained and certified to help consumers enroll in health marketplace plans. They again can help you apply and enroll in a plan with savings, or based on your household income, can help you apply for Medicaid or the Children's Health Insurance Program called CHIP. And they are required to provide fair, impartial, and accurate information. Again, I highly recommend you all to find local help and utilize what I like to call navigators or certified assisters. Now, I think that is the end of my presentation. And I know, James, we have some potential questions that we wanted to call out. You know, I first hope that you found the presentation helpful. It is definitely a lot of information, and it's a lot of information that If you're not working in it every day, it can be a little bit confusing. But again, I really hope that today you are walking away with learning something new and that you again feel refreshed about health insurance so you can make informed decisions for yourself and or your families. And again, utilize the resources that have been provided for you today. Healthcare.gov is the best resource to go to. And again, find that local help through utilizing navigators and assisters. So I think we're on to questions now.
Okay, perfect. No, thank you very much, Jason. You are truly a wealth of information. There's a lot of great things that Jason discussed. And before we jump into the question and answer, let me just update my screen. Go. Get my screen back on. Question and answer time. Again, Jason, thank you so much. You're just a wealth of knowledge. I was even taking a few notes myself. As you mentioned, for your mother, but my mother-in-law, she's in her open enrollment period now. So it's good to get some insight on some of the things that she and I could discuss. You know, I made it a point to tell her that we were hosting this discussion today, and I probably wouldn't feel as confident going through that process with her without, at least hearing this talk first. So thank you guys. Thank you, Bright Healthcare. Thank you very much, Jason, for that information. Again, it's extremely important for our viewers and our clients to know what their options are when it comes to health insurance or coverage. And as Jason mentioned, we are going to discuss some of the, frequently asked questions we received about healthcare. So Jason, if you're okay, we'll go ahead and get that started.
Yeah, let's go. Let's do it.
All right. So just looking at the sheet here, the planted questions that we have, the pretty general questions, but thank you guys for sending those in. Looks like the first question is, when is the deadline to apply for 2022 coverage?
Yes, the deadline to apply for 2022 coverage is going to be Saturday, January 15th of 2022. That is the end of what I mentioned before is the open enrollment period.
Okay, great. And I see that there's a little bit of time. So if you haven't started your enrollment now, you do have until about the middle of January to get that done. So thank you very much for that information, Jason. The next question is, who is eligible to use the marketplace?
Yes. So to be eligible to enroll in the marketplace health coverage, you must live in the United States and be a U.S. citizen or national, or be lawfully present and not incarcerated. As I mentioned, there was a list of quite a bit of who would be eligible, but it's always best to go on healthcare.gov to learn if you are eligible or not.
Okay, perfect. No, thank you very much for that information. And this aligns with a number of the different coverages that you mentioned, but the question received is, how many different coverages are available and how do I qualify for coverage?
That's a really good question. So there are a lot of different insurance carriers available in the Illinois market, specifically here in Chicago. So it can kind of be a little confusing because there's so many options. So your best bet, again, as I mentioned, is to always go and seek out assistance utilizing a navigator or a certified assister. They will really understand your needs when you speak to them. They'll understand what is going to be best for you and your family situation. So from a standpoint of what is available out there, there are a lot of options out there. But again, to lessen the confusion and to make sure that you're being enrolled in the best plan, it's always best to seek out assistance. Now, how to qualify, as I mentioned, there are those two different types of federal assistance that you can potentially qualify for. One, again, that's going to be the advanced premium tax credit, which is going to be able to help pay a portion or even sometimes all of your premium. And then there's the second, which is cost share reductions, which help reduce your out-of-pocket costs when you have to utilize your insurance. All of those two different types of subsidies or federal help will be determined based on your eligibility. So when you're going through the enrollment process, you're going to provide, again, all of your information about your demographics, about your household income, and then the marketplace will then determine what you are qualified for. Again, always best to go to healthcare.gov to see what you can qualify for and or use one of those local assisters.
Yeah, I don't think you could beleaguer that point enough. It's a lot of information. It can be daunting, especially if you aren't familiar with the insurance insurance space, or if your knowledge is very limited. So as Jason mentioned, please utilize that website and try to find a navigator to assist you with this process. That way you can ensure you're making the best decisions for yourself and for your loved ones. Now we do have a few more questions, Jason. I know we're coming up close on time, but I did want to get a few more of these questions out of the way. It looks like this next question is just around the insurance plans, and it's, what do insurance plans typically cover?
Yes, absolutely. So if you remember, there are those 10 essential benefits that must be covered. So your prescription medications, emergency, pregnancy, laboratory services, long list there. Also your preventative services and wellness, so your annual checkups, for example, those all must be covered. And that's just a short list of what some of the health insurance plans cover. The ACA really did a great job of making health insurance companies open up what is to be available to all consumers. And the whole goal with that was to make sure that everyone had essential coverage and that they can take care of themselves with their insurance, and that they can, of course, live happy, healthier lives without having to worry about any type of burdens. So not only are those 10 essential health benefits covered, but there's a slew of so many other different types of services that are covered. There's a very long list. So it's always important, again, when you're shopping, there are on the website on healthcare.gov, when you're shopping for health insurance or when the assister is helping you, there's a document available to all consumers called a Summary of Benefits and Coverage, otherwise known as an SBC. Very important, and I'm sure that a sister will show you that, but it's always very important to look at, as a consumer, the summary of benefits of coverage, because it will show you all these different scenarios on how things are covered and what is covered. It'll even show what might be excluded on that plan.
Thank you very much, man. That is a lot of great information. And again, you can visit that healthcare.gov website to get a better understanding of what type of insurance these plans typically cover. Again, use that healthcare navigator to assist you in the process. And just moving right along with the questions, there's a lot of great resources. We do have a question here about costs. So Jason, can you give us an idea approximately how much these insurance plans cost our clients or our viewers today?
Yeah, so it's really going to be dependent on your situation, your personal household situation. You can look, so you can go on healthcare.gov, you can type in your zip code and preview what the plans are going to cost. But don't let those costs alarm you, because again, those are what we like to call base level costs. Those costs don't include any type of subsidies like the advanced premium tax credit or the cost share reductions. So it's really, really important first to check your eligibility by utilizing an assister or going to healthcare.gov and filling out an eligibility application to find out how much assistance you're going to get. So, again, don't let those base costs frighten you, because it could be a lot of money, but know that you do have those two different subsidy options, those federal assistance options that can help you with lowering those costs on a monthly basis.
Thank you, and I'm sure you will probably echo this, but it's probably the cost, if that's your concern. The out-of-pocket costs can be quite daunting for many of our clients. So again, it's probably your best interest to at least look into the coverage and choose the best plan that works best for you and your family. And we do have a specific question regarding some of the additional benefits. The next question is dental coverage covered under this insurance plan?
So insurance, some insurance carriers, as I mentioned, there's quite a bit in the greater Chicago area, a lot of different insurance carriers, a lot of different plans offered. If you are looking for adult dental and adult vision, some plans definitely have those options to either buy up coverage or that are automatically included in coverage. One thing that I can tell you is that there are also a lot of plans out there that automatically have embedded into the plans pediatric dental and vision. So for those dependents and children under the age of 19 years old, will automatically have dental and vision coverage available to them. Now for adults, you're going to have to make sure that when you're shopping or getting assistance with your shopping, that you mention or that you look for plans that have adult dental and vision, because there are some that are available out there to you.
Thank you, thank you. And moving right along, I hear you mention this quite a bit, but there is a question regarding the 10 essential health benefits that the marketplace plans cover. Can you highlight, maybe not all 10, but highlight a few of some of those essential health benefits that this plan does help our clients with?
Absolutely. The 10 are ambulatory. So again, essential benefits means they must be covered. So the 10 are ambulatory, emergency services, hospitalization services, pregnancy, maternity, and newborn care, mental health and substance abuse disorder services, prescription drug coverage, rehabilitative and habilitative services and devices, laboratory services, preventative care and wellness services, and then lastly, pediatric services, including dental and vision care for pediatrics.
Wow,
so those are the 10.
That is a lot of different benefits that this plan provides. And again, it's probably better to be covered than not have covered in case any of those events that you just referenced occur or happen in the near future. Along the lines of other health benefits, I know you talked about the pre-existing conditions. Can you maybe outline what some of those pre-existing conditions are, maybe, and maybe just to add to that, what are some pre-existing conditions that may not count or may not be covered in this plan?
So the ACA and the Obama and his administration, when they enacted the ACA, they dismantled denying insurance coverage for anyone with pre-existing conditions. So you can have a pre-existing condition and enroll in these plans. And that is, again, one of the ACA, the Affordable Care Act rules. So, for example, someone could be gravely ill and having continuing services and treatment for a specific condition. It does not matter. It will be covered based on the Affordable Care Act. Now, one thing to note is there are a lot of different types of insurance products out there, and I want to kind of just highlight this. So as I mentioned, these 10 essential health benefits make up what they call, again, a qualified health plan. But there are a lot of other health insurance products out there that kind of look and feel like a true qualified health plan. But if they don't have these 10 essential health benefits, and if they're saying they do not allow for pre-existing conditions, it's truly not a real health insurance plan. So just as a consumer, be wary and be aware of all the different type of health insurance products out there, because there might be a health insurance product that truly looks like a qualified health plan, but it's not. So as a consumer, be informed about the 10 essential health benefits, and also that pre-existing is not even a thing anymore. So you can have, again, a pre-existing condition and enroll in a health insurance plan without getting denied.
Thank you very much for that. Great information coming directly from the source. And just closing out these last few questions, looks like what preventative services are covered by the plan? I know you talked about some of those preventative healthcare services. Can you outline what may be available to our users or consumers?
Yes, absolutely. So preventative health services as outlined by the ACA, there's quite a bit of list here, but let's kind of go through that. I'm going to pull up a quick list here because there's quite a bit. Okay. So preventative care, just to kind of outline what preventative care is, it's any healthcare that prevents disease, injury, or illness rather than treating an existing condition or a condition that has already become catastrophic or acute. So the goal of preventative care is to essentially do exactly what it says. We're preventing any issues in the future, and we're helping people stay healthy. So preventative care can include, and this is not limited to, doctor visits such as annual physicals, well child visits, for women, annual gynecological care, and dental cleanings for children. It could also include immunizations, contraception, allergy medications, insulin. For specific age groups, it could be for colonoscopies and mammograms. It could be screenings for such things as tests for skin cancer or high blood pressure or high cholesterol. So the big thing to remember is that preventative care, if coded properly at your doctor's office, is going to be automatically included, right? And it is for preventing future conditions. So if you have, as we've talked about before, a pre-existing condition, that would not be considered preventative care because it's already happening, right? Does that make sense?
I think so. Man, that's a lot of great information. I can't thank you enough. We do have one more question before we wrap up for the day. And it's kind of a general question, but with undocumented individuals, you know, in need of healthcare, can undocumented persons apply for ACA healthcare coverage?
So there is the ability to do that, and healthcare.gov has kind of some outline guidelines of what that looks like. So it's always best to check the scenario on healthcare.gov, or when talking to an assister, definitely mention that. But there is coverage for undocumented citizens, but there are some guidelines to that. So definitely just utilize healthcare.gov as your resource.
Perfect. And I know you've mentioned that website. I'll go ahead and give it to the audience one more time. That is healthcare.gov. As Jason said, you know, maybe a half dozen times, please utilize the navigator to help you out with this process, especially when you're shopping for coverage during the enrollment period. Jason, I can't thank you enough, but I do appreciate your time and energy in joining us this morning. Thank you to our audience members who did provide us questions or comments. Big shout out to Bright Healthcare for joining us today and making this event possible. For those of you that did not get a chance to get your question addressed or answered, don't worry. Again, we're going to have this webinar playing live on our website for you to review at any time. But you're also able to message us directly at outreach@CEDAorg.net, and we can follow up with any questions that you have. Again, just to reiterate today's talk, Bright Healthcare provides tools and technology to simplify health insurance for the Chicago and suburban Cook County residents. Our goal today is simply just to educate you about the processes and connect you with services and resources essential to you and your loved ones. Working in partnership, CEDA and Bright Healthcare hand in hand, we can definitely assure that more people are going to receive much needed support. Again, we can't thank Jason and Bright Healthcare enough for the partnership. As Jason said himself, we've shared a lot of information with everyone today. Please don't forget to visit our website at www.cedaorg.net to connect with CEDA services, as well as information on Bright Healthcare. And as always, you know, please share the information that you heard today with your neighbors and your community. Now, again, if you guys have questions about the Affordable Care Act, please call us, email us, or contact us on our social media. We will be happy to assist you. Thank you again. Please be on the lookout for information on our next CEDA Helps website, CEDA Helps webinar, which is going to feature our Family Support Community Engagement Program on Wednesday, December 1st. So thank you guys for your time this morning. Please be safe in your travels and enjoy the rest of your day. Bye-bye.